Hi, I'm Dr. Prajyoth Reddy, plastic and reconstructive surgeon here at KIMS Hospital, Hyderabad. So, thing is, a lot of people keep asking me that, sir, oral cancer, is that a dead end? Is that how it is? So, people, we see in movies, before the movies, Mukesh and the other advertisements that keep coming before the movies in the theaters, like, the family is devastated with that, reconstruction. So that is there, but that is not a true picture. With quality reconstruction, you don't have to necessarily look like that. Okay, remember, cancer is not a dead end for you guys. Oral cancer can happen, yes, in tobacco chewers and in smokers and alcohol consumers, most common. But it can happen in people with some genetic things also, some unknown causes also. So when you have oral cancer, please do not get devastated. Okay, we at KIMS offer treatments where after your oral cancer, you can get back to your normal life. For example, there's an IT professional or there is a radio jockey. After oral cancer also, he can still go do his job. He can talk, he can eat. So this is where I come into the picture in cancer treatments. All right, what is the role of a plastic surgeon or a reconstructive surgeon in cancer treatments? All right, for example, now you have oral cancer, for example, a tongue or a mandible. All right, in the cancer surgeon, the head and neck surgeon or your surgical oncologist has to remove these organs like your tongue or the mandible or any part in the oral cavity. And once that is removed, you just cannot live without it. All right, it is very essential organs of our body to talk, to eat, to speak. So for all the other the functions. So what I do, so, on the same day, so now the cancer surgeon or the surgical oncologist removes these parts. Same surgery table, OT table, I take out, for example, we're talking about a mandible now. Mandible is this bone, this jawbone. Once that is removed, I take a bone in your leg. Below the knee, you have two bones. One is the tibia, the weight bearing bone of your body, and the other one is a fibula, which is not very essential. You can live without it. So I take that bone along with its blood supply. I cut that bone exactly, design it like how your mandible was, fix it here, and give it new blood supply from the neck. And we can, in here in KIMS, and only in KIMS, you are offering this where you put teeth. You can put teeth. You wake up with the tooth on the same day in surgery. We can eat food. All right. You can go back. Imagine after a year after surgery, you won't even, no one even will believe that you're a cancer survivor. Yeah. And for now, for example, a tongue. Your tongue is removed. Once your tongue is removed, what can you do? Can you talk? Can you eat? No, right? So what I do, I take some skin and some fat from your thigh along with his blood supply, make the tongue exactly like how the tongue is, the mound of the tongue, so that you can swallow. You can lift and swallow food. You can speak. Speak will take some speech therapies. Yes, some speech therapies, and eventually your speech will be comprehensible. You can talk. People will start understanding what you're saying. So please, people, please ask for quality reconstruction. Please get your surgeries or cancer treatments done where there is quality reconstruction done. You don't have to live with cancer, with a deformity because of cancer. You have options. There are multiple options, various modalities available. All right, please ask for quality reconstruction. Thank you.